Brian McGregor. I've been a GP in York for 30 years and I've worked in all of York really, because I used to work a lot in the out-of-hours service. I used to help actually run the out-of-hours service, and I've worked as a partner in Acomb, both in the Beckfield Lane surgery and then in Gale Farm surgery. And now I work in the west side of York, just the other side of Tadcaster, in a small village practice with 4,000 patients. I'm also an LMC medical secretary. That covers North Yorkshire and Bradford, and I'm chair of the BMA Regional Council. So I take lots of representative roles and I support GPs in a lot of the things that they do on an ongoing basis, supporting them both professionally and pastorally for those GPs that are struggling. Almost every GP decides to work in general practice because what they wanted to be is a holistic practitioner. They want to look after a person socially, physically, mentally. They want to know who that individual is, they want to know who the patients are, they want to know who's related to who. And the benefit of working in the small practice that I work in is that I know almost all my patients, individually and as families. Currently in the media, the biggest gripe and complaint about general practice is about the lack of face-to-face appointments and about the ability to actually contact practices. The simple fact is that demand is higher than capacity at the moment. And that demand is high because we're coming out of the pandemic, we're still trying to address the vaccine programme, and we're trying to help out secondary care as well. Hi, we're just going to walk through the building just so you can see where the choke points are, because most primary care buildings are not fit for purpose. They're not fit for COVID, they're not fit for taking mass numbers of patients through. So just follow me through. As we enter the building, everyone has to use a hand sanitizer. As you come through, you'll see some spots on the floor where patients need to wait until there's space for them to come through. The waiting room, which pre-COVID would have taken 18 to 20 people, can now only have 2 people in it and no more. And that's due to COVID restrictions and the space that people need and the ventilation. We've got our back door open, because that's the one-way system where patients go through and leave the building. And we've got a reception hatch which actually has a spacer in here to keep people away from the actual reception desk. Our reception staff, our care navigators, they're all trained and they're asked to do what they've been asked to do by the GPs. So that's why they need to know what the problem is, and that's why they cannot just automatically put people into face-to-face appointments. There's a process that we are following to keep people safe and to keep practices safe. And within that process, we need to hear what the problem is so we can decide where best to get you seen. And sometimes that won't be a GP. General practice now has a whole team of individuals, whether it be advanced nurse practitioners, our own nurses, healthcare practitioners, physiotherapists, pharmacists, paramedics. There's a whole group of individuals that are now provided care, and it may well be that you'll get better care than seeing a GP first and being redirected, and you might see people quicker than you would have seen otherwise. So it's important to understand that for those requests that come through, it's not about somebody being awkward, it's not about somebody blocking you, it's not about not giving you what you want, it's about assessing what you need and trying to actually make sure we give you that need and address that need as quickly as we can. Most of our reception staff are on little more than living wage. They are human, they have families of their own, they are patients themselves. It is not reasonable to be shouted at, to be sworn at, to be denigrated and to be insulted. And it's vitally important that we realise that in all of our relationships, in all of our interactions, we should be kind, we should be considerate, and we should consider the feelings and thoughts of the person at the other end of the phone. We're not there to be insulted, we are not there to be shouted at, and we're not there to be abused. Coming through, you'll have seen the spot on the floor where people stand for reception, and coming into the room, this is where we will bring patients through. When a patient comes in for a face-to-face appointment, before they come in, we have to wipe every bit of the room down that any previous patients have been in, We have to make sure that every touch point has actually been cleaned. We then need to put some gloves on, as well as our masks. We put on a plastic visor, and we put on a plastic apron. So the time taken to get an apron out, put it on, put your gloves on, put a visor on, clean the gloves, and then go and actually get your patient in, bring your patient through, sit them down, do a consultation, and then as they leave, you've then got to actually take those gloves off, put another pair of gloves on, clean the room down, and then take off your gloves, your apron, your visor, and change your mask between each patient. That's why a face-to-face appointment takes 20 minutes rather than your 10-minute consultation. And that's why, if we have to do more face-to-face appointments, your access to your GP is going to get less, because there are only so many hours in the day. And if we actually have to take twice as long with each patient as we would do on a telephone call or on an electronic online consultation, we will not be able to deal with as many patients. There are not enough GPs to meet the demand. This setting here has been open from day one of the pandemic, as have every other general practice settings been open. They've not all been able to actually accommodate footfall of patients, but if your local small branch surgery is closed because they cannot safely arrange for you to go into that building and keep it COVID secure, they will be providing services from another bigger building elsewhere. At no point during the pandemic has general practice closed. It's always been open, it's always been accessible, and it's always been able to actually facilitate patient needs, although that may not always be the same thing as a patient wants. So when we talk about access to GPs, we need to talk about capacity, and you need to think about where you're going and who you're going to speak to and who is the right person to speak to. So when you think about a health problem, think about where you're actually going to be most appropriately dealt with. Think about, could you go online? Could you look online for symptom checkers? NHS.uk will actually tell you an awful lot about most problems. Can you actually go to your pharmacist and have a word with your pharmacist about what's going on? Is there anybody else that you can talk to that might be able to give you some help and support about simple problems? Can you actually go to 111 and give them a call and ask them about the problems that you're having and get some clinical advice from them? Can you use the online consultation tools that your practices have on their websites? And if all of those are not appropriate for you, then you can always call your practice and actually ask for either a telephone consultation or even a video consultation. And then, if the clinician feels it's appropriate, you could be invited in for a face-to-face. But all of these other options are things that will reduce the number of phone calls coming into practices and make it easier and safer for those that have no other option or cannot use those other options. One special case for everyone is children. As parents, and I've been a parent, I've got 4 children of my own, all grown up now, but I understand completely, as does every GP, that the concerns when you've got a responsibility of looking after a child are huge. And children can't tell us everything that's going on with them and won't necessarily come forward when they're unwell. And particularly young babies and toddlers aren't able to articulate or tell you what's going on. They're a special case. There are some very good, very clear guidelines and help available. One of them is the website whenshouldIworry.com, which actually will give you some clear indications and clear information of when you should be seeking further help, and again, what self-care and what self-management you can do with your child whilst waiting for that help and advice. As GPs, we understand that there are vulnerable members of our society that we need to take care of and we need to support. And what we need from everyone is to allow us that ability to do so. And the biggest and most significant worry, I think, for many people in the healthcare profession is that with this increased demand we have at the moment, it is almost impossible to actually allow us to give that greater care to people who are lost in that huge sea of demand, that huge wave and tsunami of everyone trying to get access to general practice. And we do not want the situation where vulnerable individuals will deteriorate whilst we're dealing with things that could have been dealt with in other ways.